Good afternoon, Dr. Robert Nucci from Nucci Medical, and happy Halloween to all. We're doing our coffee talk. I have my coffee mug. I think I showed it last week too. Coffee mug here for our Monday coffee talk. For Halloween, I decided that we would talk a little bit about blood and surgery, or blood loss and surgery, and what that means, and bloodless surgery. How much blood do you lose during surgery? Different kinds of things. Well, blood loss during surgery is common. It's very difficult to do any procedure, and probably you can't if you're doing any manipulation of any tissue without getting some blood loss. So, that is part of the deal. Now, blood during surgery is not necessarily bad. I mean, we don't want to have too much blood loss. Clearly, that's dangerous for the patient, and it obscures what you're trying to do. But the body heals by blood. That's one of the ways that it'll heal. Your scarred tissue, you got an incision, you have to heal it. The blood actually is the first part of that healing process. So you do want some bleeding. It's actually important to the healing process in at least in spine surgery and in most surgery. Clearly, you don't want too much blood loss. We want to control our blood loss because, as I mentioned before, it can obscure what you're seeing. You can't see what you're doing, particularly if you're dealing with a very small incision. A little bit of blood loss, you can't see the way you should, and it can be problematic. For ambulatory surgery, blood loss is one of the things that we think about when thinking about what patients can have procedures in an ambulatory surgery setting. In other words, have the surgery and then go home. How much blood they lose during surgery is one of those concerns. If they lose too much blood, then they may need blood or may need to be monitored after the surgery. How much it depends. Certainly a few liters of blood, you'll need to be in the hospital. But we would try to limit our blood loss in an outpatient setting because we don't want people to have to get blood transfusions. We don't want them to stay into the hospital and so on and get blood transfusions. So we try to limit the amount of blood loss that we have. But as I said, some bleeding is expected and is actually beneficial. We do check people's blood beforehand, make sure they have enough red cells that you can actually heal well and oxygenate. Right, red blood cells give you the oxygen to your tissues. So you want to make sure you have enough blood in you before you have the surgery. Different kinds of procedures are designed to have less blood loss. Some it's unavoidable. You have to make a big incision to be able to see what you're doing, and you're going to get more blood loss. But there are ways to control blood loss during surgery, different cauteries you can use, and different kinds of medical agents that you can use to decrease blood loss. So from a surgery standpoint, we expect it. We don't want too much of it. We expect to see it, and we're aware that indeed it's part of the healing process. From a standpoint of the surgery, also, we sometimes put in drains to drain the blood. A little more controversial than it used to be, but the idea being that if there's a lot of bleeding under the skin, it can disrupt the tissues and you won't heal well and get blood into the skin and so on. So, or if it's in the neck, you may have trouble breathing. So you don't want to have too much blood loss there. So we do try to control blood loss during surgery. Sometimes we actually decrease a person's blood pressure, not me, but the anesthesiologist, decrease the patient's blood pressure during surgery so they don't bleed quite as much. And that also can be helpful. So blood loss during surgery, something that we expect. It's something that we prepare for, something that we think about, and something we like to control during a procedure, but it's something also that's necessary for the healing process ultimately in most surgeries. So we want there to be a good blood supply to the tissues so that they heal correctly and don't not heal. And that, of course, causes other problems. So blood loss for Halloween, we see it, we know it, we appreciate it, we like to control it, but we know that it's also part of the process and part of the healing of the patient. So there you have some blood loss during surgery and spine surgery in particular, and spine surgery tends to be more one of the bloodier surgeries when you're dealing with the low back. There's a lot of muscle. The neck, not so much. But we're aware of it, and we prepare for it. Drink some of my coffee. See if there's any questions about blood loss during surgery. Oh, one other thing I'll mention is sometimes when we expect a lot of bleeding during surgery, we can take the blood in with sort of suction, filter it, and sometimes we don't filter it as much. We filter it and give it back to the patient. So you're giving your own blood back again. I do that for some spine surgery, can do that on total joint surgery also, and other surgeries. You're basically giving a person back their own blood. So that way we decrease the need for a transfusion. I may have a question. How long does it take for the body to replace a liter of blood? I don't think I'm going to be able to give you an exact number, but the body does make red blood cells very, very quickly. If you have a lot of blood loss during surgery, and a liter is a fair amount. When we get a liter, we would probably get a hematocrit, a blood count after the procedure, see where things are, and consider giving a person blood if it's particularly low. But it does depend a bit on the nutrition. So if you have a lot of blood loss, you will give a patient typically iron after the surgery to give them the power to make more red blood cells. But patients, at least in my experience, who've lost maybe a liter or so of blood, they're back to where they should be in a week or so. It's at least my experience. And I should say that you can lose blood, have a blood count here, and maybe it's over here when you're done, and that's still okay to go home. But generally, you're dealing with a surgery in the hospital when you're dealing with significant blood loss and giving patients iron and blood after surgery, and so on. But you do replace blood fairly quickly in your body. Your long bones make the blood. Spine makes the blood and does recover pretty quickly if you have appropriate nutrition in your healthy patient. I have another question. That is the question. No, there's another question. It's in blue. I didn't see that one. Does your blood type affect the surgery and blood loss? The answer is probably no. So your blood type A or AB and this kind of thing, it's probably not. They all, patients tend to bleed the same no matter their blood type. I know that there's at least historically, and there may be some truth to it, although it's debatable, that patients with red hair will bleed more than patients without red hair. I'm not sure how true that is. I haven't noticed that in my practice, but I have heard people say that. But that's not necessarily your blood type. Blood type, you bleed, appropriately. Now there are bleeding disorders like sickle cell anemia or sickle cell anemia trait. We can bleed more, so that is not really your blood type. But you can have blood diseases, hemophilia, thalassemia, some others. But you would potentially be screening that out ahead of time for surgery. And of course, patients who have on anticoagulants can bleed more. So that's not really blood type. So the answer is no. The blood type really does not affect the bleeding per se. Let's see. Do you need to donate blood for spine surgery? Well, I didn't mention that, but if you expect a lot of bleeding, there has been at least traditionally the idea of, okay, well, I'm going to donate, some blood for the surgery, and that way, if I need blood during surgery, they can give me my own blood. I mentioned earlier that you can collect your blood potentially and filter it and give it back to you. But another way is to draw your blood. It's not done as much as it used to be. One of the challenges, the answer is yes, you can do that. One of the challenges is that, and as an earlier question, how long does it take for your blood to regenerate? And how long does it take to replace? So it's a few weeks, as I say, a couple of weeks, maybe a little bit longer. And typically what happens is patients donate blood, and then they drop their blood count, and then they giving it the same blood back again. And maybe it was just better just to let them have their blood to begin with, because they're starting out with a low blood count. And after surgery, you got to get it back to where it should be. So giving them back their own blood would seem to be a waste in some instances because you're taking it and then you're giving it back again back. You might as well let them keep it. But you can donate blood prior to surgery, but there needs to be a time for you to get back up to where you need to be. So you potentially be on iron tablets, draw the blood, go on iron tablets, bring your blood count back up, then you have this blood in reserve. Unfortunately, and I don't think it's changed, you can't give that away. So in other words, if I gave 2 liters of blood, we didn't really use 2 liters, we only used 1, or we didn't use any, can I donate that to the blood bank? The answer, at least traditionally, has been no, you can't, because you don't go through the appropriate screening process for donating blood. If anyone's donated blood, they know that's the questions and the screening process they go through. So they toss that blood, unfortunately. Let's see if any other questions we have here. I think those are the questions. Those are excellent, excellent questions. So for our Halloween blood loss during surgery talk, so that was very cool. So I appreciate that very much. And we'll be doing more coffee talks. Oh, I meant to mention one lucky listener today will be getting a special gift. So make sure you give us your email and contact so you can get that. And it'll be a surprise. It's a Halloween surprise. So there you go. In any case, nice to at least get these interesting questions. Thank you guys very much. And next week we're doing another interesting topic. And please suggest topics that you may want to hear. Dr. Nucci from Nucci Medical. Have a good afternoon and happy Halloween.